We have a lot of questions about children, and why don't we start with those? Because I always, when I'm talking about heat situations, I'm always saying children are especially at risk, one of the groups that's especially at risk. Why is that?
You know, a whole bunch of reasons. And you say one of the groups, let's not forget the elderly.
Exactly.
You know, in the heat dome situations, most of the deaths are in the elderly. People indoors without air conditioning, but kids also, and partly because just they're smaller. They don't have relatively as much body surface area for sweating, and sweating is our #1 mechanism to dissipate heat. The other thing is awareness. Depending on the age of the child, awareness that they're becoming dehydrated, that they're becoming hot.
They're out running around. They're not paying attention
they're distracted,
to what's going on.
Right?
Exactly.
And also ability to communicate, particularly the very young child can't communicate. I'm dehydrated, I need water. So depending on the age, so there's some physical factors and then some mental factors, developmental factors there.
So parents or those who are caring for kids, teachers, camp counselors at this time of year, they need to be the ones to remind about hydration, do they? So what do they need to, how much does a child need to drink on a hot day like today?
Yeah, you know, it depends on the age of the child. You know, younger kids, 4 to 8, it's in the 5 to 6 cups. Once you're in the 14, 15 range, you're closer to 8 cups a day. But it's going to be more on a very hot day. It's going to be more if they're physically active and sweating. So again, kids will sweat, and that is our mechanism to dissipate heat. The other thing to keep in mind is look at the humidex. Once that humidity hits 75% or higher, sweat becomes a very inefficient way to radiate heat. That's when the risk of heat stroke goes dramatically up. So it's not just temperature, it's also humidity. And the thing to tell the kids really, what's nice is we kind of have an internal barometer of how well hydrated we are, and that's how often we're peeing.
Okay.
So if you're not peeing, you know, every few hours, or as you usually do, you know that you're getting dehydrated. And then look at the pee. Is the pee really dark? So you know, that is a very nice internal way to regulate how hydrated you are, and you've got to keep reminding the kids of that. You got to keep peeing, drink enough to keep peeing, and make sure it's not too dark. Make sure it's your normal urine color.
So those are the kinds of things to tell the child to watch for. Set an alarm maybe to take a drink at a certain time. People could do that too.
Bottle.
Is there anything else that parents or, again, caregivers should be telling the kids in terms of how to, you know, as you say, communication, how to express if they're not feeling well in the heat? What do they watch for? What symptoms should they be thinking to tell an adult about?
Yeah, so ideally you want to be proactive and prevent the symptoms, but the early symptoms, you'll just feel dry. You'll feel a dry mouth, dry eyes. That's the very early sign of it. As things progress, you know, you don't want to get to that point, but kids will start feeling lightheaded. Kids might start feeling tired or lethargic. Eventually with dehydration, nausea, muscle cramps. So these would be a little bit more advanced signs, but things to look out for.
Particularly with children. All right. If a child has asthma, right into your respirology wheelhouse. All right. How can that be affected by extreme heat?
In a few different ways. You know, the thing about asthma, it's the kind of disease that gets triggered by things like changes in the environment. And for some kids, heat is a trigger for their asthma. Not all kids. For some kids, it would just be allergens. And we're also in allergy season for many kids. But for some kids, a temperature change like heat will be enough to trigger their airways, and they'll go into an asthma attack. So that's something to be aware of. The other thing is that hot air often goes together with poor quality air, because we've talked a lot about wildfires, but when you get these extended heat waves, you dry out the wood. That's your, you know, where you have that ability to get those fires. And now you've got hot air and you've got polluted air, both of which trapped, and both of which are triggers for asthma. So you can get a double whammy, and some kids can really get in trouble in that situation outdoors.
Is there a way to prevent asthma attacks in those conditions, or you just know what triggers you and just try to avoid that if possible?
You have to avoid the conditions. And we've talked about avoiding the pollution, you know, air filters, staying indoors, avoiding the heat. You also have to have a backup plan, because sometimes it's impossible to avoid those conditions, and that's having a conversation with your doctor in advance and saying, if I get into a flare in these conditions, what do I do? How do I adjust my medicines? You know, at what point do I seek help? What are the triggers for me to go in to the emerge or call your office? All that should be done in advance.